Stigma contributes to social and health inequities. The slide gives examples of how people who use drugs experience inequities and stigma in the healthcare setting. The example comes from a qualitative study done with the help of PEEP members. The Public Health Agency of Canada provides an excellent summary of layers of stigma in their report, a primer to reduce substance use stigma in the Canadian health system. I would like to read an excerpt from the report. Substance use stigma can be reflected within policies, practices, training, and work culture in the health system. Example includes institutional policies that require patients to be abstinent for substance before they can even receive certain health services that don't reflect the diverse needs of people who use substances, and the limited formal training opportunities for students and practicing health professionals on substance-related topics. These are examples of systemic stigma. Systemic stigma reinforces and is reinforced by public stigma. Key drivers of public stigma includes the widespread of views that substance use and its related harms are the result of individual choice, weakness, immorality, or lack of willpower. This stigma can be expressed through various stigma practices like avoidance, blame, and judgment of people who use substances, including by health professionals. Stigma can also be internalized amongst people who use substances, leading to shame, decreased self-efficiency, and social avoidance, which are manifestations of self-stigma. Self-stigma can affect both patients and health professionals who use substances. So what is peer engagement? Harm reduction is an international evidence-based effective approach for reducing harms and addressing health inequities associated with drug use. At the heart of the harm reduction is a process for engaging people who use drugs or peers as active experts in policy, programming, and decision-making arenas. It is a powerful tool for generating sustainable change that is relevant and useful for the community it serves. Peer engagement is based on theoretical roots of inclusion and equity, benefits to peers, and providers regional differences, sharing decision-making powers, addressing stigma and trust, organizational support, and an independent network of peers. Back to you, Charlene.